there.
Hello, good morning.
I'm really intrigued by your experiences with COVID as a nurse, and I was hoping you could share your story with us.
Okay, I've been a nurse for over 20 years. Back in March of this year, we opened up our unit as a COVID, strictly COVID unit. Uh, we've been doing that for over 6 months now. I've seen the worst of it and the best of it. We started out with just our unit. We had a few COVID patients, and then the surge hit. We ended up filling up our unit. Then we ended up opening several other units. We had an ICU unit and then three different surgical units that had the COVID patients in them. And eventually we kind of merged with our ICU unit because the patients were getting better and going home, most of them. But on the other end of the spectrum, I myself personally have had more patients die in these last 6 months than I have in my entire career as a nurse. Seems to affect some patients much harsher than others. Anyone with comorbidities, the morbidly obese, the diabetics, the ones that already have a lung disease, it seems to hit them harder. And the last ditch effort is to put them on a vent, and then once you're on a vent, you have maybe a 50-50 chance of ever getting off that vent again. So kind of depressing at times, kind of stressful at times. Mostly stressful all the time. I should clarify that. But I've seen it get much better in the last month. We've changed medications several times. We started out with the hydrochloroquine, which we really didn't see a whole lot of improvement on our patients with it. We've since changed to remdesivir and steroids, and those seem to be working much better. We have a lot more people going home after a few days instead of staying for 6 weeks or longer, which some patients have. We've had a lot of them that get 3 or 4 treatments and are able to go home because they're so much better controlled. Their oxygenation is better.
How did they prepare you? How did the hospital prepare you to be a COVID ward?
They didn't really prepare us very well. I was called in on my day off by another nurse that said we were having an important meeting. We're an ortho trauma unit, and for some reason they designated us as the COVID unit. We're still not sure how that came about, why it wasn't a medicine unit, but they opted to turn the ortho trauma unit into the COVID unit. So they sent the infectious disease people to our unit, and we had a little discussion. They told us, you're going to be the COVID unit. You're going to have to wear PPE, protective devices, and you're getting your first patient in 30 minutes. So most of the nurses were in the med room crying because we didn't know what to do. They said, here, watch a video. The video consisted of a nurse donning PPE and then doffing the PPE when she left the room. They left and we were lost. We didn't know what to expect. We didn't know what to do. We had questions that hadn't been answered, such as we take equipment in the room, what happens to it? Does it have to stay there? How do we take their vital signs? How do we check their glucose? How do we do anything? What do we do? So basically we played it by ear. We came up with different ideas. I did some research. I heard about other hospitals that were keeping the IV poles outside the rooms when they were on a lot of antibiotics, a lot of medications. So we had our people at UTMB, they drilled holes in the wall to slip tubing through, and then we wrapped it with this, you get it from the fire department, it's fire retardant rolls that rolled up and stuck in the holes. And so we could do all our IV work outside because they wanted to limit our exposure to the patients. So we came up with that. Nobody came up with that but the nurses. How do we take off this PPE? What do we do? Do we do it in the room? Do we do it outside of the room? We didn't know. So we ended up getting bins, 3 bins outside, because they wanted us to try to recycle, because we didn't have enough. They didn't think we were going to have enough to last us through the whole pandemic. So they said, in case we have to recycle, take your goggles off in this one, take your mask off in this one, take your gloves off in this one. So we thought, well, how do we do that in the room? There's just not enough room. So we put the bins outside, so we would take our gowns off in the room, gloves off in the room, and then the goggles and the mask we took off outside. Any other trash went in another receptacle. But as far as the patients, at the beginning it was, it's like walking on glass. You didn't know what to expect from the patient, because they would walk in, they were walkie-talkie patients, did not seem that sick, and within a couple of hours, you'd have them on high-flow oxygen or on a vent. They would go down. Their condition would degrade that fast that you just had a constant eye on your patient. You were afraid to leave outside the room. We were constantly just walking back and forth, looking in the rooms, holding your thumb up. They'd hold their thumb up and, yeah, I'm okay. But now with this last round of using the remdesivir and the steroids, I'm not sure. I'm not an epidemiologist, but it seems that maybe the virus has mutated. It's not as virulent a strain, or else the remdesivir is working that much better. For whatever reason, the patients, we still get them. They don't seem as sick. Not as many are going to the ICU. More are going home. Some are going home on oxygen, but they're going home nonetheless. They have no other symptoms. They have no fever. They still sometimes have a cough, and maybe when they get up and walk around a lot, they will desat, and so they need oxygen at home. We do a 6-minute walk before they can leave the hospital. We time them and have them walk around in their room for 6 minutes with a pulse ox monitor on. If they drop below 90, they have to go home with oxygen.
Gotcha.
So that's the story.
Wow.
I think it's getting better. We're down from those 5 units that we had at the beginning to, we use half of our unit, which is 16 beds. We use 8 of those for COVIDs. When I left last week, all 8 of those were filled, and they were talking about reopening the other side because school's back in, it's cold, people are staying in. They were expecting another surge. I don't know if that's happened yet, but we're waiting. We don't know how it's going to react. It's such a new virus. No one really knows how it's going to act over the winter. If people have any immunity that lasts through the winter, if they don't, if they can re-get it. We do have people that are coming back. Sent them home and they were doing well, and suddenly they get a relapse and they turned worse. They come back to the hospital and then stayed a while and gone back home. But, it's just, we still know so little about this virus, and it's a scary virus. It seems like it's mutated, changed its course of action just to survive. Started out, it mostly affected the lungs. Now we get a lot of patients that have just GI symptoms, no cough, no shortness of breath, but they have frequent diarrhea, they have stomach cramps, and sure enough, they're testing positive. Some of them come in, they affect their coagulopathy now. They're having strokes, and that's a scary one. So we started putting our patients on Lovenox to prevent the strokes, prevent the clotting of blood, because they're mostly laying in bed all day. So the blood's not flowing right. You don't have good circulation. There's so many variants of this virus. It's a scary virus. And the people that say it's a hoax, it's a government plot, it's a conspiracy, I wish they would come and work with me one night just trying to keep these people breathing. I think they would change their mind.
Thank you.
You're welcome.